Yes, doctor.
Hello, Mr. Favor. I'm Mr. Dr. Verma. I'll be your physician today. Is it okay if I ask you a few questions?
Sure.
So I see that you came with a complaint of fatigue. So can you tell me since when have you been suffering from fatigue?
Oh, this has been going on for the last 1 year, doctor.
Okay. So is it continuous? Are you feeling fatigue continuously or is it on and off in nature?
Oh, doc, sometimes it is more than the other times.
So during the day, is it more during the day or night or any variation during the day of fatigue?
At night time it gets a little worse. But I have, generally speaking, I am tired all during the day, but night time it is worse.
So I'm going to ask you a few symptoms. You can tell me by yes or no if you are suffering, you're feeling that. Have you suffered from any weight gain recently?
Not exactly, doctor. Do you think I'm obese?
No, I just meant comparatively.
Okay.
Do you have any history of fever?
Oh, none.
Is your sleep affected?
Sometimes my sleep is affected.
Can you elaborate on that?
I am not able to maintain my sleep. I get up in the middle of the night.
Alright. Anything that helps with your fatigue?
I like to take a Benadryl and then sleep.
So before this year of complaint, before that, did you have any problems?
Not exactly. Just started.
Okay. Could you elaborate on your past medical history, please?
Nothing in the last 1 year. I've just seen some blood in my stool.
Alright. Is there a change in consistency of stool?
Yeah, it is more like a mushy stool, and I have some gurgling in the belly too.
Alright, do you have any abdominal pain?
No pain.
Any vomiting, nausea?
Are you asking about vomiting or nausea?
Sorry, did you have any nausea?
No.
Vomiting?
No.
Has there been a change in your diet?
No.
Any change in your appetite?
No, not exactly.
Any medications that you're on?
I just started taking multivitamin.
And are you allergic to anything?
No.
So Mr. Favor, what do you do for a living?
Oh, doc, I am, I've worked in a research lab.
So you have always worked in a research lab?
Yeah.
Do you consume alcohol in any form?
No, just mild alcohol on weekends, but nothing major.
What do you drink?
Just beer once in a while.
Do you consume tobacco in any form?
Not exactly, doctor.
Could you elaborate on your family history? Does anybody in your family suffer from similar complaint?
No.
Any family history of elevated blood pressure?
Not exactly.
Elevated blood sugar?
No.
Any other chronic illnesses?
No.
Could you, if you don't mind me asking, could you tell me about your mental health, please?
I'm doing fine, doctor. It's just the last 1 year. It's just, I have less sex drive. That's probably nothing major though. I'm not really worried about it. Just, I'm just tired,
Any history of overnight hospitalization?
No.
Any problem with bladder habits?
No.
So the blood in the stool that you mentioned, when did you notice it the first time?
About a year ago.
Do you have any pain while defecation?
No. What is defecation?
While you were passing stools?
No.
So the blood, is it bright red in color or is it dark red in color?
It's not black and it's not bright red. Maybe it's in the middle, but it's not for sure it's not black. Why did you say Dr. Good?
Sorry, good that you can tell me exactly. So it's better that we know what kind of blood you say so that we can conclude it better.
Okay. I thought you said good, that you are having a bleeding.
I'm so sorry, I didn't phrase it correctly. I'm so sorry. Any weight loss?
Yeah.
Oh.
I've lost, some few pounds, 10 pounds. But I'm doing exercise. That's why I probably have lost some weight.
Any night sweats?
No.
Okay. Do you mind if I examine you, Mr.
Yeah.
Phil? Could you lie down for me, please? Thank you. I'm going to cover you here. Is it okay if I... Thank you. So I don't see any scars, any swelling, any marks here. That's good. Listen to your voice now.
What happened, doctor?
I'm sorry, I forgot to put on glass.
Okay. It's okay, doctor, if you want to give me some germs.
No, I would. That's the last thing I would do.
But you already given me the germs. I'm so sorry.
I'm so sorry. I didn't intend to. I'm going to feel for your abdomen now. Please let me know if it hurts. It's okay, you can do that now. Could you hang your legs down for me, please? Any problem with your legs?
No.
Any pain or numbness?
No.
Or any other thing? Any numbness around when you sit? Any pain when you sit? Could you push up, down, in, out? Could you push up, down? Okay. Can you remove your glasses, please? Could you look down? Could you look up? Can you please open your mouth for me, please? Mr. Faber, from the history that I've taken from you and the examination that I've done, I'm of the opinion that there might be some problem with your large intestines, which is causing the blood to appear in your stool and the change in consistency in your stool. So we can't be sure of the cause yet. We'll have to do some investigations. So I'll be ordering a complete blood count, complete metabolic profile, an ultrasound of the abdomen. I'll be also suggesting you get a colonoscopy so that we can have a better look of your large intestine. Before the ultrasound, you can even get a chest, abdominal X-ray done.
Why do you need an abdominal X-ray, doctor?
Because sometimes some conditions can be seen by an X-ray as well, and it is less costly. So then we can.
You appear to be very doubtful, doctor. So, what history I gave you, doctor?
You gave me a history of fatigue, blood in the stools, and weight loss, and decrease in sex drive,
and mushy diarrhea. So, what is the pathology of mushy diarrhea? Weight loss, malabsorption can happen, right? So when that is the history, what test are you going to do? Are you going to do a small intestine test or the large intestine test? Okay, when you are having a mushy diarrhea and you are having a blood in the stools, okay, when your sleep is disturbed at night, are you going to ask for restless leg syndrome? Yes. Are you going to order magnesium level, zinc level, celiac panel, and calprotectin, pancreatic elastase? And no, you should have asked for alcohol history in the past. I am not alcoholic right now. Again, I just told him that if you are asking the alcohol history, if I'm not drinking, that does not mean that I'm not drinking for life. So this could be a chronic pancreatitis case, and pancreatic elastase, lipase, amylase, right? And so I could, again, I'm giving you a difficult scenario just to open up your neurons that I can take in this direction. When I started, believe me, when I started this case, I gave this case to you as a fatigue. I had full intention of taking it to just the bleeding. While presenting, I knew that due to this blunder, I changed my clinical scenario. I did on purpose. I want you to think. I want you to make a set of questionnaires. If a person comes with a mushy diarrhea, you are going to ask for questions about small intestine. That's why I have given you the acronym Galen-Gulam. Always ask about stool. You start thinking about, if you have a mushy change in bowel movements, palate shaped, ribbon shaped, any, you had time. It's 15 minutes just now. You still had so much time. After doing everything, you still had time.
You didn't figure that mushy, everything floating.
Yeah, again, it is when you have to read a lot. Okay, it's going to happen. You don't take this exam lightly. Just, this is my request. Don't take this exam lightly. People who ignore this test, they say, oh, it is just a communication skills test. They are the biggest fools. This is the malpractice lawsuit exam. This is a health literacy exam. Don't take this exam as a step 2 CSS. Take this exam as to make patients happy when you're practicing in the real life scenarios. How will you make every CEO is looking into the patient experience score. If your patient experience score is down, You will not be hired. You'll be asked to leave. This is a patient experience. I think this exam should be changed to a patient experience exam. Every nurse practitioner, every healthcare giver, every physician assistant, every medical student should take. I can guarantee you this exam will be for everybody coming years. So think it as, okay, if you're not able to diagnose a problem, how much extra money you're going to spend? First you're going to do misdiagnosis, and patients will not get helped. Again, the chronic cycle of giving this fatigue. Okay, you're fatigued. I'm going to, even if your testosterone is normal, fatigue, give you testosterone shot. Go to a hormone clinic. It's crap. You have to get to the root cause of the problem. Okay? So, again, I'm a tough SP. So that's why you're here for. Immersion coaching. Open up your mind. Read. Read my book. Alright? But good job. Don't get depressed. I'm going to give you a tough time over here.
I never
thought. It's okay. Don't get depressed. I know you're getting emotional over here. Don't get depressed. Alright. Thank you for watching the video. Enroll now in our Lean Patient Experience Certification course, link in the description below.